So why do we age? Typical signs of aging, abnormal signs of aging, how to treat aging. So aging is a gradual, continuous process of natural change that begins in the early adulthood. The body changes on a cellular and molecular level that results in changes in the function and appearance of our organs. During early middle age, many bodily functions begin a gradual decline, and the physical symptoms of aging begin to set in. So it is a natural process of human life for any living organisms to um, age, but we start noticing changes in the middle age. People, and if you're on your 30s, you start experiencing and seeing some bodily functions that begin a gradual decline. You might start seeing that you're not as flexible as you used to be. It is harder to do, maybe get up from the floor or bend down without experiencing like difficulty, balance sometimes. So those are some of the signs that we start seeing in our early middle age. Some people might experience worse signs due to other conditions that affect their health, but on the normal levels, that's what we could experience, and it just affects at a cellular and molecular level that impacts our organs. So not only we're getting old on the outside, but on the inside as well. Why do we age? Nobody can really tell why. There's a why. No one knows how and why people change as we get older. We just see the physical changes and feel the physical changes in our body. So wear and tear is known as a major cause of aging, known as an oxidative damage by or byproducts of metabolism. Other theories view aging as a predetermined process controlled by genes. The maximum human lifespan is estimated to be approximately 120 years old. Some people can live that older. That's the oldest person that we have known alive, and it was somebody from Japan, followed by a 119 years old lady from the United States. So people can their span life could be that long. So in why do we age? There's not really a specific reason. There's many theories. Some say that is the oxidative damage of our bodies and metabolism. We function with oxygen. When you cut open an apple and you leave it just there, just see that it starts getting brown, right, due to the oxygen. So that's the affects that's how it affects that apple in our bodies. In humans, it's also believed that it is because of we start getting oxidized. It is part of us. And something is just a control process by our genetics. Aging is a very complex process and it varies as how it affects different people. It does not affect everybody the same way. That's why you can see somebody that is 50 years old that can hardly do some stuff while you have 80 years old that's still being very active and healthy. So the aging process affects different everybody. The life expectancy through the years has changed. In 1924, the average life expectancy um, in the US was only 59 years old. So people would only live up to 60 years old in 1924. COVID impacted the span of life in the US. It decreased the average U.S. Life expectancy for the first time in the mid since the mid 1990s. So since the 1990s, we were, the lifespan was higher, but after COVID impacted us, it changed people's life expectancy and it decreased. The United Nations projects the life expectancy in the United States in 2024 to be 79.25 years old. So, meaning almost 80 years old. That's what we can expect people in the United States to live as of this year. Life expectancy has increased over 19 years in 1 century. So, people has starting to live longer. However, the recent events such as COVID has impacted that, and this is because how we have extended the lifespan of humans is because of the improvement in healthcare. We have found vaccines, we have found medications that help people live longer. When even when they have a specific health conditions that affect them. So, but with healthcare and medicine, we have extended that. What is normal in aging? Things that you can expect as we age is the changes in our skin. Our skin has less elasticity, may become fragile or thin, and that's what you see in older people. And so as we get older, that's what it's gonna happen to ours that are younger. The blood flow decreases. That's why people experiences dizziness when standing up, fast from sitting. And it's because the blood flow decreases as our vascular system changes. There's difficulty moving, there's less flexibility, there's joint pain. You start seeing this as you age. There's decreased muscle mass. We lose muscle as we age. That's why we would have hanging skin in our arms, in our legs, part of our bodies because of the uh, loss on muscle mass. There's weight gain for people. People start getting way more easily, and it's harder to get rid of that way. There's hormonal changes that affect the weight, and there's a slow metabolism. So that's why people that is in their elderly stage of their life, people that is 65 or older, they start eating less. They start eating less, they start getting full faster, and this is because the metabolism changes and it starts changes at the age of 30. That's why once we pass 30, just losing weight is a very hard thing to accomplish because of the changes that we are experiencing. So for somebody that is 65 years old older, though their metabolism is even slower. Uh, Conditions that are signs that we can see as normal aging in our skin are wrinkles, dark spots, thinning and dryness, veins are more visible, and there's skin tags. At a cognitive level, people start getting more forgetful. But let's just not even get it confused with dementia. It's not the same being forgetful as be having dementia. It's completely different. And dementia is not the normal, it's not normal from aging. So forgetting some details, some stuff, it's normal compared to dementia. Uh, Also, thinking speed is slower. We are thinking at a slower pace. It's difficult. It's more difficult to retain information. That's why they would forgive information that is given to them. There's social rules and behavioral changes. They don't socialize as easily with other people as they used to do maybe when we were younger. And they reduce language fluency. Their language is more reduced. At a physical level, there is a stiffness, there's body mass loose, there's the bones are less dense, this is known as osteopenia. There's also osteoporosis and menopause. These are physical changes that people experience with aging. And the metabolism again is something that it changed a lot. So there's weight gain, there's the metabolic rate is the way that we absorb and digest food also changes. The slowdown is gradual in metabolism. Lost muscle mass is to blame, and there we start having less energy. These are normal signs of aging. That's what we can expect to happen to our bodies, and that's what you will see in the elderly. But it's important to understand that not all signs of aging are normal. Again, when it came to forgetfulness versus dementia, it's not the same. Sometimes we misunderstand aging and attribute signs and symptoms of disease or illness to getting older. You're having more pain because you're getting older. You know, where I'm having more pain because I'm getting older. I'm forgetting things because I'm getting older. So there's normal and not normal when it comes to all this. We can expect as we age, changes in our eyes. They start getting drier. There's trouble adjusting to lightening changes, and farsightedness as well changes. Our ears start to change as well. We start having hearing loss. Um, some hearing loss is normal as long as it's not drastic hearing loss or complete hearing loss. That's not normal. Loss of balance, we start losing balance. That's part of normal. But if people is losing balance and they start having falls or dizzy, that's not normal. At a neurological level, forgetfulness again, it is you forget where did you put your keys, for a minute, where you forgot to um buy something from the groceries. And you experience those things even when we are young. So but as we age, it tends to be more frequent maybe, but normal. It is still normal. And there's a slow thinking and cognition. When it comes to behavior, uh tendency to become agitated could be sometimes normal, but it doesn't always. It is normal. So somebody that it's constantly agitated, it is not normal. Patience changes. People start having less patience, and changes in interest. You're not interested in the same things that you used to. Other normal part of signs of aging could include achy joints, some pains when you stretch your arms. Um, it could be normal as long as it does not affect you in a way that you cannot do activities of daily living. It is considered normal. Once you start having a functional decline, then that's not normal. Um, Bladder leakage, frequent urination, it's also part of the normal. That doesn't mean that is the same as incontinence. Like having leakage, you cannot hold urine for a longer period of times, and it can happen that there's a leak. But when it's completely incontinence, where people would pee completely, that's not normal. And frequent urination, it is also something that becomes normal. Uh, People start going more to the bathroom because of the bladder not being able to hold as long as it used to. And some medications as well, people that is in the elderly phase, they are usually taking a bunch of medications, and many of these are medications that make them go to the bathroom more frequent. What we have to pay attention to is the abnormal signs, knowing when is something not normal. When it comes to eyes, cataracts, the cataracts are not part of the normal. It's not because we're getting old. There's another reason why they happen. Glaucoma is as well not normal, and diabetic retinopathy is also not normal. It's because of other conditions in the eye and the health, like diabetes. So when this is important to keep vision checks frequent and also attend those appointments. Ears starts if there's total hearing loss, as I mentioned before, that's not normal. If people can completely hear on one or both ears, it is not normal. Vertigo is also not normal, and vertigo is just a general diagnosis. It's not a disease specifically. Under vertigo, there could be many reasons, and it's just that people getting dizzy and losing balance. But one of the things that could be going on when there's vertigo could be on the vestibular system, which is in our ears, but it could include many other things. So vertigo is not a diagnosis. It's just a general name that doctors use for somebody that experiences loss of balance and constant dizziness. So it is important to, when there's vertigo diagnosis, to follow up for proper care, because they would usually give you dizziness medication that will not cure the vertigo. So it's important to address and target whatever is going on under vertigo. Neurological conditions or abnormal signs include Alzheimer and dementia. Again, dementia is a bunch of different things that affect our cognitive status, and it's not normal. It's not the same as forgetfulness. Under dementia, people start um, getting confused, having mood changes, but their common sense is not longer there, you know? They no longer know the functionality of some objects. For example, they might start looking at a remote from the TV and they don't even know what it is or how it works when they used to know how it works. Um, Maybe putting in the microwave the keys of the house or the phone, things like that. You know, they start losing the common sense, things that the logical part. So those are not normal things. Dementia and Alzheimer is not normal, and face blindness as well. It is not normal to have mood disorders, depression, and anxiety as we get old. Also, the side effects of medications that affect behavior, it is not normal. Um, Also, things that like arthritis and incontinence is not normal. They can be something going on. So it is important to be able to recognize those signs and report them to the nurses, the doctors, the family members when you start noticing that there's these signs that usually we think that it is associated with getting old, but in reality it is not. So always pay attention to those changes and make sure you report. Our organs can be older than us. I don't know if anybody knew, but this is attributed to different things. The organs can be aging faster than we are. We can be 40 years old and have a heart of a 90 years old or an 80 years old. You can have 45 years old and you have kidneys of an 75 years old. So our organs can get older faster than us. So the diet that we have now influences a lot of that. So things like red meat or processed meat can make our organs to get older faster. Refined sugars, and excessive salt and sodium. Those are things that are in our diet that if you don't consume them with moderation, it can promote your organs to start getting older than what you are actually are. The sedentary lifestyle, it also change. It has to do somebody that does not do a lot of physical activity and is just at home, doing nothing but watching TV and sitting and eating. That also affects less than 150 minutes of moderate exercises per week or 75 minutes of high intensity physical activity. It's all good and recommended to stay healthy. Smoking and vaping are also other things that affect our organs, the lungs especially. Sleeping less than 7 to 9 hours per night. I know that's almost impossible due to the lifestyles that we have. We're always rushed to go to work, to wake up early, to go pick up kids, to go um I don't know, cook or something. So most people don't really have bad sleeping habits or sleep up to 8 hours, but 5 hours is the at least recommended. Five continuous hours of sleep will help you. The BMI is has to be between 18.5 to 44 point 24.9%. That should be the BMI. Anything above that can start making people overweight and obese, and that also will affect your organs. And when you don't regulate your blood sugar, your blood pressure, and cholesterol, this also affects different parts of our body, making them um, get older. So it is important to keep a healthy diet and an active lifestyle. Aches and pains versus asymptomatic diseases. Aging aging results in the deterioration of our bodies on a cellular level, affecting every symptom and organ in some way. As early as the mid-20s, our bodies may become sore and tired more easily from use and take longer to recover from overuse. People that is in the mid-20s, once you pass 25 and you go to the gym, so you go hiking after a long period of time of not doing it, you will feel more tired, more sore. Uh, and it takes longer for the body to recover from that overuse um, of our muscles. So from the mid 20s to late 40s, these aches and pains should come and go depending on the use and lifestyle. Tendons and ligaments lose elasticity while cartilage deteriorates. Persistent and severe pain is not normal. For those that were in the earlier presentation on pain management, could identify when pain is not normal, is not part of aging at all. If rest does not improve a condition when it comes to pain, there might be an underlying condition that has to be properly addressed. Movement and exercise can help abate and relieve pain. The more you do some walking, can help with your knee pain or your back pain. Any prevents as well. So this is not just aches and pains. How to treat aging. In the 1513, famous explorer Ponce de Leon arrived in what is now known as Florida. He discovered the fountain of youth, what they call the of youth, and they believed that by drinking from the spring's magical waters, you could ensure you maintain a youthful appearance and halt aging in its tracks. That's what they believed when they arrived to this part of the continent. And however, it is not real, even though there might be some truth to it. Of course, when Europeans arrived to America, there was clean water, right? There was untouched water compared to the water that they had in Europe, which there was a lot of pollution. Water was dirty, people was getting sick, and they would die at 35 years old. So when they arrived to a part of the world where there was clean water and they were drinking that clean water, of course, they were not getting infections, they were not getting diseases, and that's why they lived longer. So they started to believe that it was a because magical waters that there were in the continent would make them uh, to keep young. So it has some truth to it, but it is not that it is a magical water. You know, it was just clean water. So how to treat aging? There's not a cure. There's no way that you can stop from getting old. Unfortunately, everybody's gonna get old. You cannot avoid it, but we can do stuff, modify habits that will slow the process and avoid pain in medical complications. That's why, you know, doctors recommend to maintain an active lifestyle, to maintain good mental health care, eat nutritious meals and stay hydrated, reduce stress and stressors, have yearly physical and dental exams, to avoid or completely quit smoking or vaping. Body massages and physical therapy also help the body. Pay attention to podiatry. Good foot care equals to avoiding falls, and this will just translate into having a better lifestyle. Um, Wear sunglasses to protect your eyes, and also sun protection is very important. People still not doesn't understand the importance of our skin, which is the largest organ of the body, and it's important to also protect it. Stimulate your brain every day. Those keep hobbies, do stuff that you enjoy. This will stimulate your brain. Build a strong social network. This is to keep you in a healthy mental status, and engage in confidence building activities. Try to get hobbies, but go to, if you have the opportunity to enroll in yoga and Zumba exercising class, or some activities that make you build confidence. This will help you to maintain and slow down the process of aging. And final tips and takeaways. It is important to know that you and everyone around you will age. We all gonna get old. Our bodies will begin aging before physical symptoms are visible. We start getting old, and then the physical symptoms show up. Organs can age faster than us. Remember, if you don't keep a healthy lifestyle, if you smoke, if you drink too much, you will contribute to your organs to get older than what you are. Maintaining our physical, mental, and emotional health is important for a healthy aging. Somebody that was active during their younger phase, You can see a lot of 80 years old and still being independent. They go for walks, they don't need assistance, and that's because they kept a good uh, health style, healthy style when they were younger. So whatever you do now is gonna impact how you look when you're older. And be proactive. Always, you need to start healthy habits early. It's like now. If you're in your 30s, is the time that you want to start making those changes in your lifestyle. If you're, and also it's important to stay consistent. Maintaining healthy habits is a lifelong challenge. So if you start a diet, it is important to keep that diet. It is not only to lose weight, but the whole point with diets is to make it a lifestyle. You for us to eat well. So don't start a diet today, Monday, and you're done by Wednesday. It is important to maintain a consistency. If you start going to the gym or you start taking a walk as well, keep consistency. And not all the things that we associate with aging are normal. Remember what's normal and what is not normal when it comes to the symptoms that we start having as we get old. And that's all from this presentation. Does anybody has a question? If so, you can get unmute yourself or just put it in the chat. Again, if this was the first time that you had this training on the physical symptoms of aging, you will receive a certificate uh, on your email. It's gonna be taking some time as they're still working on certificates, but you will receive it eventually. You're welcome. That's all from me. If you don't have any questions, you're welcome to go. And there's another training at 2. If you received an email to be able to join, then you can join. It's about ethics and sanity your health values. Is it okay to introduce seniors to weightlifting if they never lifted before? No. I mean, you can talk to them about them, Reem, but you would prefer them to go for assessment if their pays patients, um physical therapists are the one in charge of that. So if they never lived before, of course, it's important to see what they can do before we actually put them to do stuff that may, instead of help, hurt them. Of course, as long as it's not heavy weight. If you have them do some exercises with 1 pound weights, of course, that's not gonna really hurt them if they don't have any conditions. If when they start doing that exercises, they start complaining of pain, of course it is important to stop them from keeping it because it can be that there's something going on. So